Thank you. Hello and welcome to Alice Corner right here at CCTV, Channel 17 in Chittenden County. But this show is also in collaboration with LCA-TV at Public Access Television right there in Franklin Grand Isle. Today, we are here to talk about access to basic needs in the Champlain Valley area. Most of the time when we talk about access to basic needs, the first thing that people think about is housing, work, let's say, right? Healthcare, food and all of it. But there is much more than that. So today we have two distinguished guests that are doing amazing work in the state of Vermont, and we will soon allow them to introduce themselves. We have a couple of questions ready for them to answer and also for them to share about the great work they do on a daily basis on behalf of children and families. We are going to start with Wendy. Can you please introduce yourself, and then we go to Michelle.
Sure. Thank you for having me here tonight. My name is Wendy Rice. I'm the president of Vermont Connector, and that is an organization that works to build resilient and strong communities, specifically through the mechanisms of mutual aid, volunteer coordination, and civic engagement.
Excellent. Wonderful. And Michelle Treya, who's joining us remotely.
Hi, everyone. Michelle Drea. I'm from Northwestern Counseling and Support Services Parent-Child Center. I'm the Family Access Coordinator. NCSS is one of the designated mental health agencies, and the Parent-Child Center is one of the state's designated parent-child centers.
Wonderful. Thank you. As you can hear, they're wearing multiple hats in the community right here. So for our first question, we'll start with Wendy. And Wendy, can you tell us what is Vermont Connector? And also it seems that there is another program within it called the Baby Exchange Program. What is it? Can you tell us what do you do?
Sure, I'd be happy to. As I mentioned, Vermont Connector really works to build strong and resilient communities across the entire state of Vermont. And we use mutual aid delivery, volunteer coordination, and civic engagement to help build stronger communities. We really try to connect people, passion, and place around topics of importance that will have a greater collective impact, and we really try to leverage Vermonters helping Vermonters and achieving more impact across the state. While we have a breadth of projects and activities that we undertake, we've had a particularly strong role in resource coordination and community mapping for the COVID-19 pandemic, as well as the flooding events that happened in 2023 and 2024. And the subject of tonight's conversation, we also have a program called the Baby Product Exchange, which is an opportunity to distribute gently used baby equipment to families with unmet needs across the state. And that's in partnership with over 55 social service and mutual aid organizations across the state. And so that's been a truly needed project and having a lot of impact in the community already.
Exactly. Wow. 55 organizations that you already partner with. Yeah. This is amazing. And when was it created, the whole?
Vermont Connector started in 2018, and then the Baby Product Exchange started in 2022. So just after the pandemic, as I was seeing more and more unmet needs for families around equipment and diapers and wipes and other provisions.
Wow. It takes a village to raise children.
Absolutely.
Yes. Michelle Treya, NCSS, what is NCSS? What is the Parent Child Care Center? What do you do? And it seems also that you are part of the Hunger Council in the Franklin Grand Isle region. The floor is yours, Michelle.
Absolutely. Thank you, Ali. So Northwestern Counseling and Support Services is one of the designated mental health agencies within the state of Vermont. I work out of the Parent-Child Center, which is also designated within the state of Vermont. They are spread throughout the regions. And in that role, NCSS strongly believes in having staff be able to join community councils so that we're able to, talk about what's happening at the agency, but also learn more about what's happening in the community so we can better serve. So I have been privileged to be able to serve as one of the community co-chairs of the Hunger Council in Franklin and Grand Isle since June of 2022. The Hunger Councils are convened by Hunger Free Vermont. It started with 2 back in 2006 and has grown to 10 regional councils across the state. And they're coalitions of basically community members and local organizations that care deeply about hunger in our communities. They work together to raise awareness, share information, brainstorm solutions, and build effective collaborations. And these collaborations continue outside even of the meetings, with partnerships and emails and networking.
Amazing. You guys, it seems that you do a lot of work. In addition to your position, you also support the Hunger Council in the FGI region. So maybe, Michelle, you can paint us a picture about hunger in Franklin Grand Isle. What are you hearing? What are you seeing? What are the challenges, etc.?
Absolutely, Ali. So what we're seeing through not only our NCSS staff, but obviously through the Hunger Council and the food shelf volunteers and coordinators, is that there are more and more people that are needing to utilize the food shelves and food resources in the communities. That is also being seen statewide. The Vermont Food Bank has distributed more than 14.5 million pounds of food so far across their networks in the state so far, which is actually 2 million more pounds than they anticipated in having to distribute. And over 200,000 more of those pounds have actually come to Franklin and Grand Isle County, which are the 2 counties that we serve. Some of the food shelves, because of the increase in demand, including more and more people having to access resources, have never had to access resources before, have had to actually limit the number of times that people come or limit items. The Vermont Food Bank actually estimates that about 72,000 people on average every month have to access the food network distributions and their other distribution sites to be able to get food. Some have chronic needs while others are temporary. With that all said, I thought it was important that we highlight some of the actual data. So I asked some of my community partners to give me some real hard facts on what's happening. The Champlain Islands Food Shelf in Grand Isle, since 2020, has actually seen the number of households per week accessing their services more than double. So that's in 4 years, it's more than doubled. The Sheldon Methodist Food Shelf in Sheldon, Vermont, which is a small town in Franklin County, in November 2023 served 851 individuals. In November of 2024, it actually served 995 individuals. So that's over 140 more individuals. And then if we look at numbers from like Martha's Kitchen, which is our local soup kitchen, they're on record pace for over 55,000 meals served this year, which is 10,000 more than last year. And Ali, I'd be very remiss if I didn't mention Age Well, as we are, in fact, Vermont is the 3rd oldest state in the nation. So Age Well is one of the agencies on aging who serves Chittenden, Grand Isle, Addison, and Franklin counties, and they are serving through Meals on Wheels over 5,600 individuals, which equates to over 280,000 meals on wheel, plus their congregate meals and grab-and-go sites. And so on the statewide Agency of Aging screening tool that they do, 49% of those screened by Age Well scored medium to high risk for food insecurity.
High risk. Wow.
So that's incredible and very sad. That's, so if we put it all into perspective, if we look at all the systems that all of us are trying to work across, what does this all mean? Well, what it means is that people's basic needs, as your show is titled, are not getting met. And when people's basic needs are not getting met, then they really are having to use a lot to concentrate on, a lot of brain power to concentrate on their survival skills and just getting their needs met as we would look at through Maslow's hierarchy of needs. So when people don't have access to basic needs, what can happen through, as we find, like at the agency I work at, is that people might not have enough concentration to really work on other skills that they need to build on, such as physical health, mental health, or recovery, or any of those pieces, because they really need to get their basic needs met first.
Absolutely.
So that they can
Absolutely.
work on the other skills.
Yes, wonderful. Thank you so much for providing the service and also for bringing facts about data and all of it that you're seeing, what you're hearing. We'll come back to you, but Wendy, maybe it would be good also for viewers to understand, what the baby exchange program is, how does it work, how people can access the services, and it seems also that you are providing a unique service throughout the state of Vermont. I have never heard of anything like this. So please paint us a picture.
Yeah, I think from the outset, the Baby Product Exchange is trying to fill gaps for those many unmet needs that are already happening in our community, whether it be housing or healthcare or childcare or just basic cost of goods. Families have to make really tough choices between those necessities. And unfortunately, a very high percentage of our children are living in poverty. So it ties into food insecurity, but according to the state of Vermont's children report, 28.5% of children under age 12 lived in households with incomes below 85% of the federal poverty level.
28.5%.
28.5%. Across the state, children living in poverty ranges anywhere from 22 to 40%, depending on the community and the mean incomes in that community. It seems as though when you account for inflation from 2021 to 2022, median family income actually fell by 1.5%. Public Assets Institute indicated that we have the second highest rate of homelessness in the country. There are gross unmet needs. And in the case of baby equipment and diapers, there are not public services that offer any sort of discount or opportunity to purchase these items. So items needed for safe sleeping, safe hygiene, may be a choice that a parent has to make to forego because of these other expenses. So the Baby Product Exchange tries to address those needs, reduce the increase affordability, decrease mental health stress on parents by providing equipment that's donated. So functionally, community members provide their gently used equipment. We maintain that in a photo inventory, and then social service workers or mutual aid workers from across the state can access that directory. And then the equipment is provided free of charge to all families that have participated. And we've been successful in distributing over 1,100 items of equipment to families. And have had at least 460 individuals interact with the project and use the services in some way. And so hopefully we are easing the burden of parenting and empowering parents, and also addressing a gap because those other systems and support services like WIC or SNAP or Medicaid or Medicare don't provide a corollary benefit. So the goal is to keep kids healthy and safe, and to ease that greater burden on parents.
Of course. It takes a village to raise children, and in the state of Vermont, we should be very thankful of having people who are thinking outside the box, but also with international experience, right? Providing support and care elsewhere, and now concentrating your experience, your energy right here to supporting people, right? We will come back to you one more minute, but before, Michelle, I think earlier you talked a little bit about the Champlain Island, food shelf, and the Sheldon Methodist Church, how things are doubling or they seeing increase, right? And I was just also wondering about, what other challenges are associated with access to food. Like, because Franklin Grand Isle is spread, right? Are there other issues? Maybe the food is there, but people are not able to access it. Can you tell us a little bit about what's going on in that area?
Yeah, so some of the issues that we're seeing basically with access to food is, and people that call me on the phone regularly will tell you this, you can probably, is that the cost of everything in everyday life right now is challenging for people. So more and more people are having to access resources that have never had to access resources before. And what is happening with the food shelves is that there are so many more people that are accessing that it is really cutting into what they're able, what they have for food, sort of thing. So they're having to sometimes limit how many times a month someone comes or what they're able to give out. And they also sometimes, what we're finding is sometimes they don't have access at the food shelves right now to some of the staples that they might have used to have. Like one of the ones that I hear about every month at Tucker Council is that the food shelves don't have access to peanut butter, which we know is a real staple for many households. So there's those barriers. And then the other barriers that we're seeing is that even if people need to access the food shelf, is how do they get there? There's some transportation issues because Vermont and Franklin County and Grand Isle County are very rural. So how do people actually get to where the food is? So,
Excellent, amazing. And Michelle, Wendy, earlier you talked about there are 55 organizations, how many, that you work with, right? Can you name us a few of them? Is it WIC?
Sure. Yeah, it's really broad ranging. It's parent-child centers, it's the family centers, it's organizations like Lund or Good Beginnings, CVOEO, COTS, even food shelf partners. It's really across a broad swath of organizations that work with New Americans, the unhoused and homeless, low-income families, a lot of different populations that may need a little more assistance to meet their needs and to achieve that. And so the way our program works is primarily through partner referrals. So if you are needing assistance connecting with any of those organizations you're affiliated with, there's a good chance they're connected to us. But there's also the possibility to connect with United Way and 211. There is an individual assistance webpage called findhelp.org, where you can also make requests for equipment, and that's targeted case management that carries across organizations. And then we are hosting more and more pop-up events and sort of broader distribution days, and those are generally advertised on our internal social media on Facebook, Vermont Connector Baby Product Exchange, as well as many of the parent and family Facebook pages across the state, such as Vermont Mamas Pay It Forward or Parents and Caregivers of Burlington, Vermont, and Vermont Beyond is often a good place to seek resources and ask assistance and connect with the project as well.
And you worked with Thomas Fleury in the food shelf, right? What was the nature of that partnership like?
Yeah, Building Bright Futures, the Vermont Kenna's Parents, and the New North End Food Pantry are my core partners from the beginning of this project. The nature of the food shelf partnership was that we were able to establish them as a distribution center for the statewide diaper bank until that unfortunately had to close due to lack of state funding. And they also helped me to distribute equipment through the food shelf, and clients could request it through the food shelf and I could deliver it there. And they were hugely helpful in terms of storage and giving me space to start the project, as well as some of their members contributed really valuable volunteer support for marketing and posters and flyers and other things. So they really gave me a foundation to start the project and to launch it.
Yep, wonderful. So Michelle, I mean, you heard the nature of partnership that, for example, Wendy's doing throughout his work, right? You also, I mean, just told us about the issues related to access to food, such as the transportation, right? And are there organizations that you partner with outside of the council to support, let's say, you mentioned BBF. Are there other organizations in the region or statewide supporting the work that you do or the gap you are trying to fill?
For sure, Ali. Well, in our region, Building Bright Futures has actually helped also with trying to address the gap by being able to use some of the grant money to provide gas cards at some of the regional food shelves to families that are needing to access services. And then there are just other partnerships all over. The Vermont Food Bank is a huge partner to everybody in the region and across the state as far as being able to get food to where it's going. And then I think so many community partners just come together and try to talk about this and to work it out, but also refer people when the needs arise to the services that are available. So there's a lot of great partnerships that are happening within the region to address this need.
Absolutely. Wonderful. And Wemby, maybe if we come back to you a little bit, you mentioned Vermont 211, you mentioned Help Me Grow. Those are basically helping you to, raise awareness to let people know that these services actually are available. But how are you funded, like, to do your work? I mean, I think you are tapping into the infrastructure that already exists, right? And it's growing, 11,000 people that you serve or 11,000 items that you shared out. But how are you getting funded to coordinate all of it? How does it work?
Up until recently, it was largely a volunteer initiative.
You did all of this since 2018, volunteering.
A whole bunch of it with a lot of support of just amazing community partners and community champions.
Yep.
But the project is actually poised to scale in large part because of a grant from the Vermont Early Childhood Fund from Building Bright Futures. It's an access grant that is really giving us the possibility to expand our scope, to have more impact, to integrate more partners, to serve more clients. But that's a stepping stone towards a longer range plan where we can be more self-sufficient. And so volunteer support, financial support, business support, there's a lot of ways to get involved and to seize upon this moment of using that seed money very well for further impact.
Wonderful. Okay, that's beautiful. And Michelle, maybe let's talk a little bit about as someone in the system, as someone who is trying to provide the service for the vulnerable populations, what are the hopes? What are the aspirations? What would you like? What would you want to see? If you had a magic wand to just say, all right, if I do this, everything will change, what would that be? Like, what are the hopes? What are the dreams?
Well, to find the magic wand would be first, Ali. That would be fantastic. My hope is basically this. There's something that I always reflect upon when I'm thinking about this, and it's words from Chef Jose Andres from the World Central Kitchen. And he said, if we continue to do things the way we're doing them and continue to fund things the way we are funding them, what we'll have in 100 years is basically the same problems. I don't want the same problems in 1 year, let alone 100 years. People are hungry. So my hopes and my dreams is that there is basically, for anyone that is listening, when people are talking about the needs of our fellow Vermonters and our fellow citizens and our fellow people and human beings, is that there's a call to action, is that people spread the word, that there's a community awareness that this is happening. People in Vermont are hungry, and we, even as individuals, all of us can do something, whether it's spread the word, whether it's advocate at the state, local, or federal levels, and also just anything else that we can do. Even if we can't be like, oh, we can write the biggest check in America, to the Vermont Food Bank or one of the local food shelves, can we buy one extra can of food a week to put in the food basket at the grocery store, so that way we can help. Can we tell friends to do the same thing? I think those are my hopes and my dreams. And I think the other thing that I really am hopeful for too is there's a lot of big things. Wendy mentioned housing and all of those pieces that are really Vermont needs to tackle and to come to grips with. And as we tackle the big ticket items and those pieces, I just want to make sure that we don't also lose sight that people are hungry and we need food. And there's already an infrastructure in place to get food to people. So how do we make sure that it's fully and well funded to meet the growing need?
Exactly.
So I think it's...
Yeah. Yes. So, finish your thought. Yep. Sorry.
No, that's okay. No,
That's
I think
good.
that was just
That's
it.
good.
So
I think
call to action. Do what you can,
Call to
everybody,
action.
please.
Right. And for viewers also to understand that I believe that all of those food shelves and many other organizations also are accepting donation. We are all going to be with our families now. Maybe we have the means, but also let's think about those who are struggling. They may not say it outside, but the problem is there. And for anybody listening, please consider making donation to the Hunger Free Vermont or to food shelves in Franklin Grand Island and across the state of Vermont. I think that's how we build communities. What do you see as aspiration? What's your magic bound? What if you had to solve this problem today? What would that be?
I consciously chose to live in Vermont because I think we have an exceptional sense of community and civic engagement and neighborliness. And in spite of all the problems and in spite of all the challenges that we face, I really feel like Vermonters pull together as community and take care of each other. And that's really compelling and wonderful. And I've been overwhelmed by the array of support this project has gotten and the ways that it's responded to needs. In terms of my aspirations, I think that I think it's a gross collaboration with organizations across the state to keep chipping away at the problem, to keep innovating, to keep having new solutions. But in the short term for the project, we need to build our own internal capacity. We need more resources. We need more referrals. We need more clients. So that's an invitation to a lot of organizations to connect with me and see where we can leverage each other's resources. It's overcoming things like the transportation issue in a rural state. That is an impediment to growing my project because many people do not have access to transportation, cannot transport heavy equipment home, and I don't currently have the means to deliver it directly to their house or to serve communities like the islands or the kingdom with efficiency and really help at a scale that's helpful. So even if it's things like setting up distribution centers, facilitating transportation, if you're a business and you have paid volunteer days, maybe your staff could support the project or support those deliveries. It's overcoming some of the nature of being rural and delivering services in a rural community.
Yep, wonderful. Thank you, and I think now the conversation is so great, but we don't have enough time to continue. But just wanted to say that, thank you again so much, CCTV, Channel 17, for hosting us here today to talk about hunger, to talk about access to basic needs such as baby items, right? And also we want to thank also Building Bright Futures because both of you mentioned it as providing food, maybe staff time, like grants, things like that. And, I think also when the last flooding that happened, I think the message from the governor was very clear that we need to step up, and both of you are doing it, and the people that you work with are doing it. This was Alice Corner. Today we were talking just about access to basic in Franklin Grand Isle. We were joined by Michelle Treya, NCSS Parent-Child Care Center, and also Wendy Rice, the president of Vermont Connector. wanted to say really thank you both so much, and also thank you for LCA TV at Franklin Grandaya for also airing this. Thank you, CCTV, and guys, everyone, see you next month. Have a great evening. Thank you.